Hey everyone, and welcome back to the channel. Today, we're tackling a topic that's crucial for every man, and for the women who love them. It's a subject often surrounded by silence, embarrassment, or confusion, but it doesn't have to be. We're talking about prostate cancer. It's the second most common cancer in men worldwide. In fact, about 1 in 8 men will be diagnosed with it in their lifetime. But here's the most important thing to remember. When caught early, prostate cancer is one of the most treatable cancers. So knowledge isn't just power here, it's protection. In this video, we'll break down everything you need to know, from what the prostate is, to the symptoms, the screening debate, and the latest in treatment. Stick around. What exactly is the prostate? Before we talk about the disease, let's understand the organ. So what is the prostate? Think of it as a small, walnut-sized gland that sits just below a man's bladder and in front of the rectum. It wraps around the urethra, the tube that carries urine and semen out of the body. Its primary job is to produce the fluid that nourishes and transports sperm. Because of its location, when the prostate acts up, whether due to cancer, infection, or simple enlargement, it directly affects urinary and sexual function. It's a small gland with a big role. The enemy, understanding prostate cancer. So what goes wrong? Like all cancers, prostate cancer begins when cells start growing out of control. In many cases, this growth is incredibly slow. Some men live for decades with prostate cancer without it ever causing any problems. This is why it's often found in older men during autopsies who died of other causes. However, and this is critical, some forms of prostate cancer are aggressive. They can grow quickly and spread, or metastasize to other parts of the body, like the bones and lymph nodes. This is why screening and understanding your risk is so important. Know the risk factors. You can't change some risk factors, but knowing them puts you ahead of the game. Age, the single biggest risk factor. The chance of developing prostate cancer rises significantly after age 50. Family history and genetics. If your father or brother had prostate cancer, your risk doubles. Certain inherited gene mutations, like BRCA1 and BRCA2, also increase risk. Race and ethnicity. African American men and men of African descent have a higher risk. They are more likely to get prostate cancer at a younger age and have a more aggressive form. Obesity. Some studies suggest that obese men may have a higher risk of developing an aggressive form of the disease. If several of these apply to you, having a conversation with your doctor before age 50 is a smart move. Symptoms, what to watch for. Now here's the tricky part. In its early stages, prostate cancer often has no symptoms at all. This is why it's called a silent threat. When symptoms do appear, they can mimic other common conditions, like an enlarged prostate (BPH). Be aware of urinary issues, a frequent need to urinate, especially at night, a weak or interrupted urine flow, difficulty starting or stopping urination, pain or a burning sensation, blood in the urine or semen, sexual dysfunction, difficulty getting an erection, painful ejaculation, or, in advanced cases, pain in the hips, back, or chest. Crucial point. Having these symptoms does not mean you have cancer, but it does mean you should see a doctor to find out why they're happening. The screening dilemma, PSA test and DRE. This is one of the most debated topics in men's health. Screening can save lives, but it can also lead to overtreatment. Let's look at the two main tools. 1. PSA blood test. This measures the amount of prostate-specific antigen, a protein produced by the prostate, in your blood. A higher than normal level can be a red flag for cancer, but it can also be raised by infection, inflammation, or a simple enlarged prostate. 2. Digital rectal exam, DRE. This is the physical exam where a doctor feels the prostate for any lumps, hardness, or asymmetry. So what's the debate? A high PSA can lead to a biopsy, which has its own risks, and sometimes we find slow-growing cancers that would never have harmed the man. Yet he may undergo stressful treatments with side effects like incontinence or impotence. The current guideline is individualized screening. Talk to your doctor about the pros and cons starting at age 50 for average-risk men, age 45 for high-risk men, for example, African American men or those with a family history, age 40 for the highest risk, for example, multiple family members diagnosed young. Diagnosis and staging, the roadmap. If a PSA test or DRE is suspicious, the next step is usually a biopsy. A small needle takes samples from the prostate to be analyzed. If cancer is found, it's given 2 scores. 1. A Gleason score. This grades how aggressive the cancer looks under a microscope, from 6 less aggressive to 10 very aggressive. 2. A stage. This describes how far the cancer has spread. From stage 1, confined to the prostate, to stage 4, spread to other organs. This information creates a roadmap for your treatment. Treatment options, from surveillance to surgery. The great news is that there are more treatment options than ever before, and the choice is highly personal. For low-risk cancer, active surveillance is often recommended. This means monitoring the cancer closely with regular PSA tests and biopsies, and only treating it if it shows signs of progressing. For localized cancer confined to the prostate, options include surgery, prostatectomy to remove the prostate, and radiation therapy to kill cancer cells. For advanced or metastatic cancer, treatment focuses on controlling the cancer and managing symptoms. This can include hormone therapy to stop fueling the cancer's growth, chemotherapy, immunotherapy, and targeted therapy. Every treatment has potential side effects, most commonly related to urinary, bowel, and sexual function. It's essential to have a detailed, honest conversation with your urologist and oncologist about your specific case and your personal priorities. Conclusion: your health is in your hands. So let's recap. Prostate cancer is common, but highly treatable when caught early. Know your risk factors, be aware of the potential symptoms, and most importantly, have an open and proactive conversation with your doctor. Don't let fear or embarrassment keep you from taking charge of your health. Be your own advocate, get informed, get screened when it's right for you, and share this information with the men in your life. If you found this video helpful, please give it a thumbs up and share it with a friend, a father, a brother, or a husband. Let's break the silence around men's health. And if you have personal experiences or questions, drop them in the comments below. Let's support each other. Thanks for watching, stay informed, and stay healthy. See you in the next video.